Hey there, I'm Dr. Ortho, and welcome back to Pain Management University freshman year. You may be watching this video because you or someone close to you has been diagnosed with sacroiliac joint pain. Let's focus on what this condition means, how its pain is diagnosed, and how we manage the discomfort. Before we start, be sure to have reviewed the video on neck and back pain to better understand basic spine anatomy. The sacroiliac joint connects the sacrum at the base of the spine to the pelvic bone. Remember, the sacrum and pelvis serve as the strong foundation and support for the spine that lies above. This joint needs to be quite strong, yet flexible at the same time in order to support upper body movements. For this to happen, it's surrounded by extensive, resilient ligaments that run in nearly every direction. Think of the ligaments as a tape that connects the pelvis. The ligaments are wrapped so tight around the pelvis that it resembles a mummy. Nearly every motion in the body involves the sacroiliac joint. It helps support the upper body, serves as shock absorption, allows walking and thigh movements, and allows postural changes. Since it has so many functions, it's inevitably prone to dysfunction. How? Well, remember this key life skill. The key to healthy living is everything in moderation. I know, easier said than done. If only we had the strength of Arnold Schwarzenegger, the discipline of Mahatma Gandhi, and the flexibility of Simone Biles. Okay, enough daydreaming. Too much movement can cause dysfunction. Hypermobility or instability can cause pain. Also, too little movement can cause dysfunction. Hypermobility from a lack of flexibility or excess muscular tension around that joint can cause discomfort. Patients usually report pain in the low back and hip region. Pain may travel into the groin or even down the back of the leg. Diagnosing this condition is by no means a cakewalk. After all, it causes problems that resemble disc herniation, facet joint syndrome, or even a muscle strain. Your doctor will likely perform a physical exam and review your history to determine if this condition may be related to your pain. If your pain just started, a brief period of rest is usually good enough. Ice and heat can be used in alternation to help reduce swelling and release tight muscles, respectively. Anti-inflammatory medications can also be considered, but be careful not to use too much. If your pain is related to stiffness, your doctor may suggest manual manipulation of the region. Now, this can be done with chiropractors or other health professionals. If your pain is related to excessive mobility, physical therapy focused on strength training may be ideal. If the pain is severe, we can administer anti-inflammatory medications directly into the joint. This is generally a medication in the cortisone family mixed with a local anesthetic. The shot is given using X-ray guidance. The goal of this is to reduce inflammation and minimize pain while performing home exercise or manipulation. An injection to the joint may take 3 to 5 days or up to 2 weeks to fully take effect. Ice is usually applied to the area for the first day after an injection. Heat can be applied after the first 24 hours, and patients can resume normal activities thereafter. If your pain is chronic and unresponsive to more basic remedies, surgical options do exist to help stabilize the joint. This option would require consultation with your physician. Unfortunately, no one treatment works for everybody. For that reason, we often suggest mixing strategies, often at the same time. As we discussed in earlier videos, we have to hit this with land, air, and sea. Okay, we hope this video has been helpful. Be sure to subscribe for more videos, and remember, no video can replace a formal medical consultation. Talk soon.